My name is William Palmer Jr. I'm a rehabilitation physician. I did my medical school training at the University of Buffalo School of Medicine and did my residency at the University of Pittsburgh Medical Center. I am presently medical director of the HCA Inpatient Rehabilitation Center at West Marion Hospital in Ocala, Florida. And I'm also chief medical officer of the SciMed Health, which is an independent medical practice in Ocala, Florida as well. Let's talk about some of the dysfunctions that patients may encounter after a stroke. Traditionally, you think about paralysis or weakness, resulting in deficits in standing and walking and transfers and balance and swallowing and bathing and dressing, all the traditional things that you need to be able to do to be at home and functioning on your own. And then there are abnormalities in sensation, including decreased ability to feel pain and touch, as well as temperature and position sense. And when you think about position sense, if they're having difficulty with their sensation and their position sense, they may not be able to assess where their limb is in space, and that can become an issue. So the therapists do work on that aspect. Then you have also difficulty with understanding and using language. And the speech therapists and the psychologists generally work on some of this. You may have aphasia, you may have heard about that term, and that's a language disturbance. And when you think about aphasia, you can think about it in two ways. Expressive aphasia, which really means that the patient has difficulty expressing what they want to say, but they generally know exactly what you're saying to them. And then there's receptive aphasia, where the patient has no difficulty expressing themselves, but they don't really understand what you're saying. So what they are responding to may not be exactly what you talk to them about. And then you have some cognitive issues, those including high-level thinking and memory and reasoning and judgment. And usually the speech therapist and the psychologist will work on that, but the whole team does as well. Emotional disturbances and emotional liability. This is where sometimes you say, this person is not the same person I knew. And sometimes they'll be very depressed, and depression is very common after stroke. About 30% of the stroke population will experience depression. That is something that the psychologist definitely deals with. And then you may have visual deficits that all the disciplines will address.